Yeah.
Dr. Patel, you know, people always ask, like, why do I need a crown or a cap, as it's called, after a root canal? Especially since many people, they did have a root canal, they did not have a crown, and years later, nothing bad happened. Tell us about why that is.
Well, after the root canal is done, the blood supply to the tooth itself is cut off at the tip of the root. And the tooth itself is dead, but it is attached by periodontal fibers to the bone. That does not mean the tooth is as resilient as when it was with the blood supply. And with the resiliency out, it is just like breaking a leaf from the tree and leaving it aside for a long time. And you hold the leaf, it will crumble down. The tooth itself becomes very brittle. So at times when you put the pressure in the wrong places, it can fracture. And once it fractures below the gums, then we have to do a surgical intervention of doing a crown lengthening or so. Or at times the fracture is so long that we may have to extract the tooth. So every time after a root canal, when a lot of tooth structure has been lost, we would suggest for a crown build-up and a crown itself. Sometimes we may have to put the post, not necessarily all the time, but many times we have to stabilize the tooth with a metal post inside the root just to make it stronger. And the tooth itself, once it is covered by the crown, the tooth may last for a long time.
So what you're saying is that if a person had a root canal and no crown and still nothing happened, he basically was lucky? Is that what you say?
He may be lucky, or too much tooth structure was not removed from the patient's mouth. A root canal, say a tooth is completely there and there is no decay, but still the tooth is painful because of a trauma or something, we may create a very small hole and do a root canal, and he may not need a crown. But 99% of the cases do not fall under that category. They come with a huge cavity, and along with that huge cavity, a lot of tooth structure is lost. And eventually, or all the time, we have to make a crown so that the rest of the tooth structure is well protected.
Okay, I can see that. So as bigger the hole was at the beginning, or as bigger the infection or whatever, you might have to be drilling the hole much more. So basically the tooth becomes like not only brittle because there's the blood supply, as you explained with the leaf, but it becomes just a hollow, like a pipe. And of course that breaks much easier than a full thing. That's basically what it is, what you're saying, right?
Right, yes, definitely.
Okay. Well, all right, I can see that. So basically, if a dentist says put on a crown, it's not because he wants to make more money. It's because he knows that eventually it will break, and that costs you a lot more. Because at that point, you probably need an implant or a bridge, and either way, it's expensive and not worth it.
Yes, you're right, 100%. It would be wise to spend initially, make a crown, and save the tooth rather than wait to fracture. And once it fractures, if it is above the gums, it is good, we can still make the crown. But if it is below the gums, we may extract the tooth.
And I bet just like a flat tire, it never fractures in a good time, right?
Yeah, it fractures a day before Christmas or on the Christmas Eve.
Or at a wedding.
Or on a Thanksgiving Eve. Or when you are eating a small piece of bread, I was eating it fractured. Well, the crack has already happened long back, and it may fracture any time.
Thanks, Dr. Patel. I'm sure it helped patients understanding why they need it.
Thank you, Alma. Thank you very much.